The rise in COVID-19 cases is leading also to more hospitalizations.
Yeah, our Coco McAvoy talked to a doctor about the growing cases in young patients. She joins us live from Pasadena. Coco.
Yes, good afternoon. We're seeing a rise in cases for people who are the ages of between 18 and 40 years old. And the concern is sometimes that age group serves as caregivers for their parents or grandparents, so they could be passing along COVID-19 to an older population as well. In California, people are returning to some of their normal activities, but COVID-19 cases are rising, especially for young people.
Young people, it's harder for us to stay at home. We're used to being out and about and doing stuff.
And with businesses opening, people gathering and protesting, some young people aren't staying home.
We've been trying to stay inside, but at the same time, you know, with little ones, what can you do?
It's also becoming the norm for hospitals to see younger patients. And Dr. Suman Radhakrishna says it's troubling.
Now what we're realizing is it's not just protecting your parents and grandchildren, it's also about taking care of yourself. Because, I'm seeing 20, 25-year-old people so short of breath in the hospital. It's not funny. And these kids should not be there.
Radhakrishna says some of the patients have underlying health conditions, but others do not.
They are probably doing a little better than our parents and grandparents in the sense of more likely to leave the hospital, but it's still very preliminary. But nobody has to go through this torture and this illness.
The latest numbers show more than half of the people with COVID-19 are between 18 and 49 years old. So doctors are stressing the importance of safety measures.
You have to go to work, I understand, wear a mask, hand sanitizer, wash your hands, and keep the distance.
And of course, we keep hearing doctors say wear a mask, practice social distancing, and that's because they say it is so important to do so in order to prevent the spread of the virus. Back to you.
I think we always ask, where do you think you got it? Where do you think you picked it up? Does the doctor know? Can she tell those patients she's seeing, Coco?
So that's interesting. She said that when she asked her patients if they have any idea where they got it from, they're saying that their entire family has tested positive for it, and they're pointing to things like backyard barbecues. So it's seeming like people are gathering more, and therefore entire families in some cases are testing positive.
That's what a lot of the health experts are saying. We're starting to see family gatherings once again. Coco, thank you.